Well, talking about people going out and having problems, a kinetic recliner chair is designed to help people with diabetes and other disabilities that they can help them with it. Take a look at this. Dave, we saw a great program here today, seeing some of the patients come in here and using this machine here, the bed that they lay on, and they all look happy.
Yeah, they are. It's interesting. There's a number of different maladies we've been able to treat. But one thing is across the board. After an hour treatment, people get off with a wonderful sense of well-being. We see a lot of people improve their standing up straight. A lot of them improve their gait as they're walking. And yet others will reduce their blood sugar. So it's every day, it's a different challenge. And I feel so fortunate to be able to do this because I see people walking in every day and I know that this process will really help them.
Well, we saw people here today that have them in their home. There's a lot of that going on too.
Well, it is, and you know, we have a number of people that have diabetes, and as you're aware, that there are 25 million diabetics in the United States. We have been able to reduce the blood sugar on every single one significantly. In my own case, my blood sugar was 187. I also had neuropathy. The neuropathy for me was in my legs and in my toes. I could not feel my toes, and the doctor was saying, well, Dave, we may have to amputate because you are a diabetic. And that scares a diabetic. Yeah. He says, oh my God, amputation is no fun at all. So they come to us, and quickly their blood sugar goes down and the neuropathy goes away. Now, if they stay off of it and they don't come back, it will come back. There's nothing that we know today that can cure neuropathy. There's nothing we know today that can cure edema. There's nothing that we know today that can cure Parkinson's. What we're able to do is to eliminate a lot of the symptoms. For instance, with a number of people with Parkinson's, they have severe tremors. It's quite often we see people within 30 minutes of being on the bed, the tremors either diminish or they go away. Now, depending on who you are, that can last from an hour and a half to 6 or 7 hours. With repetitive use, and I suggest 5 times a week for an hour, it's almost eliminated. Now, one of the important things that we don't think about and people don't talk about is we're able to stop the progress being bad of diabetes or any of the maladies that we face. So we're able to stop those so they don't get worse. So that's a benefit that most people don't think about, but stopping it is a good thing.
Well, Brian, I appreciate you showing me how this machine works, but what do you think of it?
I think this thing is just absolutely fantastic. I mean, it's actually saved my life the way I look at it. You know, I've had neuropathy in my feet, and according to my podiatrist, at the rate I was going, I was destined to have one of my legs amputated.
Ooh. And where does that come from?
It comes from diabetes.
Being a diabetic?
Type 2 diabetes, yep.
For how many years?
And I was type 2 diabetes for almost 15 years.
Okay, you on the needle?
No, I'm not. Type 2, I was on pills, medication.
Oh, great. You're doing that good then.
Yep. Yes.
That's good. And then what have you found out since you've been using the BPM?
Well, since I've been using it, the neuropathy in my feet is clearing up. I can actually feel my feet. You know, when I first got on the bed, it had been 12 years before I really felt it. You know, as a matter of fact, 2 weeks before I found these people that I had burnt my feet at a beach and into blistering on my left foot.
Oh, wow.
And the doctor was very concerned about that. But with getting onto the bed, within 2 weeks of getting on the bed, this has cleared right up.
And how has it affected you? You're a salesman, right?
Right. Yeah.
So what do you sell? Where do you at?
I've got to get out and I walk a lot, you know, and the numbness in your feet actually affected as far as how much you were walking. And now I'm down to a point where it doesn't bother me at all, except for the fact that now I found out I got arthritis that I can feel.
And how long have you been using the machine?
I've been using the machine probably for, it's been about 4 years now, I guess. Well, whenever they came out with it, I was one of the first people that get involved in using it.
Brian, what would you say to other people out there watching the show around the country and seeing a machine like this if they have any of these problems?
Well, you've got to give it a try, and you've got to give it a serious try. I mean, depending upon what's wrong with you, you just can't get on it for 15, 20 minutes like I thought the first time and think it's going to work for you. You know, you at least got to spend an hour on it, and you've got to do it every day for about 4 days. You'll definitely feel a difference of what's happening. I've got friends that had holes in their legs that they couldn't cure at the wound center. I told them, go try this bed. They've got on the bed. Within a few days, those wounds are closed on them.
Wendy, we're on the BPM machine here, and you look pretty good going up and down there.
That's one of my favorite places to be.
Yeah. How long have you been using this now?
Almost exactly 1 year.
All right. And what is the condition that you use it for?
Mostly for edema. But it's a stress reliever. It's so relaxing. If I'm having a crabby day, it helps me out. You know, a great attitude adjuster.
Yes. And how often would you use it?
I use it every day for at least an hour.
Okay. Well, it's just that it does cost money to have one in your home. You want to buy one.
Yes.
But it's much more convenient for you. And you're talking about you doing some the accessories for it.
Yes, I am. My sister and I are going to be making a cover and some throw pillows on it. It's going to look like a nice piece of furniture. We're making a little pouch that'll be pockets along the side for your TV remote or cell phone or your book, whatever you want. And it's going to be very well dressed.
So I'm thinking, now when you lie there for an hour, what do? Watch TV or read a book or sleep?
I don't sleep usually. I listen to music, watch TV, and a lot of times I just relax. Yes, and often I just find it's nice just to, I call it zoning out.
And Len, we're talking about this BPM machine here, this bed that we can lay on. What's the BPM stand for?
Blood pressure modulation.
And what does that mean?
Well, it's 3 words that tells a lot about the circulatory system and the lymph node system. And what the inventor has done is create a passive way of exercising the body so that those 2 systems, circulatory and the lymph nodes, get like a boost. It's like putting a power pack, an extra oxygen source on you. And the drainage, that's what the lymph node systems do. They drain out the bad stuff and recirculate it. Now you've got more oxygenated good stuff going into the areas that are in pain.
For healing wounds and almost everything.
All that and much more. We're finding much anecdotal evidence of wounds that have not been healed from diabetic ulcers. Going on a year, working out at the hospital at Beaumont, no success. They get in a recliner that takes them about an hour a session, and their body is tilted 30 degrees down, 30 degrees back in a very pleasant, comfortable way, and we're seeing wounds heal within 6 weeks, and they remain healed.
And how about as a psychologist? And psychologically, that's got to make you feel better that you're feeling you're healing, and you see something there. You work with your patients to help them to get better.
It does have a relaxing, calming effect, and you can get your breathing timed with the movement of the machine, which is 6 times a minute, go in a certain measured direction. You can meditate. You can come out refreshed and revigorated. So all of this is very helpful to chronic pain patients. Last night I talked to a group of 30, chronic illness, most of them pain, a lot with the neuropathy, but some with the Parkinson's, some elderly with the dementia that's starting to come in. More blood is what we need anywhere in the body.
Right.
And I think that after talking with the inventor and reading us and trying it myself, that we've got something here. We've got to get the word out so that more people can benefit from it.
Right. You know, sometimes I find it hard to believe that such a simple invention like this kinetic chair can make such a difference in so many lives. Well, that's it for this week's show. I sure hope you enjoyed it. A Wider World is there for you. If you have any questions, to get a hold of us at awiderworld.com. Don't forget, please support your local PBS station.